Many of you know who he is, but you haven't met him yet. And today you're going to get to meet the man, the myth, the legend, Mr. Richard Gonzalez. Thank you, Rick, for joining us.
Grant, thank you very much.
It's great to have you. Tell me something. Why did you buy Allergan? Hello. Welcome to the Technology of Beauty, where we interview the movers and shakers of aesthetic medicine, aesthetic surgery, all things beauty. Today is our inaugural first telecast of the Technology of Beauty, and we have brought the biggest mover and shaker ever. We have Mr. Richard Gonzalez as our first guest. Many of you know who he is, but you haven't met him yet, and today you're going to get to meet the man, the myth, the legend, Mr. Richard Gonzalez. Thank you, Rick, for joining us.
Grant, thank you very much for inviting me on the show, and nice to see you again.
It's great to see you again. Rick is the CEO and the chairman of the board of AbbVie Pharmaceutical, and you may know that AbbVie recently purchased Allergan and Allergan Aesthetics, I think for 64 billion, something like that? 63
billion, but who's counting?
But who's counting, right? And today we're going to find out just what Rick's going to be doing. Rick is, as I mentioned, the chairman of the board of AbbVie. He was at Abbott for 30 years. Is that right?
That is correct.
And there he served as the president and the chief operating officer. And now, how many years have you been at AbbVie? 13?
Well, we spun AbbVie out of Abbott in the beginning of 2013, so we're going on our 8th year.
Okay, terrific. Can you tell us a little bit about yourself?
Sure. As you indicated, I joined Abbott as my first professional role, and I worked for Abbott for about 35 years. So I basically dedicated my life to healthcare. And Abbott was a diversified healthcare company, so we had everything from cardiovascular devices to medical diagnostics tests. You've probably seen recently that they were one of the leaders in COVID testing, one of the first to come out with a COVID-19 assay, both an antigen assay as well as a viral assay. So that was a significant business for them. Nutritional, they had a large nutritional business. Abbott makes, I sound like an advertisement for Abbott. They make Similac baby formula and Ensure. And then they had a large pharmaceutical business that ultimately is what AbbVie became. We spun out of Abbott in the beginning of 2013. At the time, we represented about 65% of Abbott's revenue, so we were a significant part of Abbott at the time, and became an independent company in January of 2013, and have had a very successful track record as an independent company.
That's great. Thank you. Where are you from?
Originally from South Florida. So I
right?
grew up in South Florida, the Miami, Fort Lauderdale area.
Well, it's great to have you. Tell me something. Why did you buy Allergan?
Well, there were a number of appealing things as it related to Allergan. You know, as you probably know, Allergan has both a therapeutic business and then they have an aesthetics business, which you're certainly very familiar with. About 2/3 of the business is a therapeutic business, similar to the AbbVie business, and 1/3 of it is aesthetics. And there are a number of franchises within the therapeutic side of Allergan that were interesting to us. I'd say one that's an important addition is they had a significant neuroscience and neurology business. And we have a large R&D effort in the area of neuroscience, in particular in disease-modifying therapies for Alzheimer's, Parkinson's disease, and multiple sclerosis, MS. But we don't have a large on-market presence in that area. And so Allergan brings to us a significant on-market presence for neurologists and psychiatrists. And so that was an important addition. But as we all know, the crown jewel of Allergan is their aesthetics business. And I'd have to say it was probably the single most attractive thing that brought us to ultimately make the decision to do the acquisition. We like the business a lot. We think the business has tremendous opportunity going forward. It has great attributes when you look at the market growth in this business, and the ability to grow the market longer term, we believe, is tremendous, and it has great opportunity to bring more innovation. So it has great people and great products, and I couldn't be more pleased to have Allergan as part of AbbVie.
That's great. Well, as you mentioned, Allergan is big in aesthetics, and
Yes.
as the past president of the Aesthetic Society, I'm very close to Allergan and Allergan Aesthetics, and I assume you know that Allergan has been our largest supporter historically of the Aesthetic Society. Allergan is a premier partner of the Aesthetic Society, and Allergan has contributed very generously to the educational purposes of the Aesthetic Society and has been just a fantastic partner. Can we expect the same moving forward from AbbVie?
When AbbVie goes into a franchise, we tend to go into the franchises in a way that we want to create a leadership position. And an important part of that is connecting with the medical community and making sure that we play an important role with the medical community. And so I think you can expect that level of support going forward. That's something that we believe in. We believe it's important. It helps in educating patients on what the most appropriate procedures are, and it certainly helps us in having a connection with key physicians like yourself and helping to direct how we're going to innovate in the market. And innovation is very important to us. It's the core of what we do.
You mentioned innovation. You mentioned previously R&D. Could you tell us a little bit about your R&D budget? I know I read that you spend over $5 billion a year already with AbbVie. Just how do you look at the Allergan Aesthetics budget? Are you going to continue along those lines with their R&D? I think they're spending about $200 million or thereabouts. What are your plans for R&D as it relates to Allergan Aesthetics?
I would say one of the core principles of AbbVie is creating innovative products. Our mission, we describe internally, is to create medicines or other products that can have a remarkable impact on people's lives. That's what it's all about. We try to do that in oncology. We try to do it in immunology, and certainly that's a core principle as it relates to the Allergan business, the aesthetics business going forward. So we've doubled the R&D budget since we launched AbbVie in 2013. We expect to continue to grow the R&D budget. Right now we're spending about $5.2, $5.4 billion on internal R&D. We spend roughly another $1 billion a year on external R&D, bringing things from the outside, because you can't innovate everything within the walls of your own organization. So in total, we're probably investing in the neighborhood of about $6 to $6.5 billion in total R&D. As I said, innovation is critically important to us. And one of the things I really like about the aesthetics business is Allergan's certainly on the forefront of innovation today. But I think it is an area where we could invest much more significantly in the business to be able to bring greater innovation and bring that innovation faster to the marketplace than maybe historically we've been able to do that. So we're absolutely committed to creating new products. You know, R&D is the lifeblood of our business. And when you bring new products to the marketplace, if they truly do have a remarkable impact for people, the financial rewards tend to follow.
Mm-hmm. When you talked about the other part of R&D, were you referring to the other billion? Was that M&A type things, mergers and acquisitions?
Yeah.
So if that's what you've been spending up until now, are you thinking about M&A acquisitions, you will, of products and services and so forth in the Allergan Aesthetics business?
The way we look at our innovation cycle is each of our businesses develops a long-range plan of how they want to innovate in the marketplace based on the objectives they have and ultimately where they think they can take the market going forward. And typically, I would say on average, about 50% of our R&D effort is internal R&D to support our growth going forward. And then about half of our growth tends to come from assets that we acquire on the outside, because you can't have every technology platform that's developed internally. So we do encourage all of our businesses to evaluate technologies that are on the outside. And one of the things that we've done with the Allergan acquisition is we've set up the aesthetics business to operate differently than it did as part of Allergan before we acquired it. We've set it up as a totally independent global business unit within AbbVie. So it's a dedicated business unit, has a dedicated commercial organization. All they represent is aesthetics products and only call on aesthetics customers. It has a dedicated R&D organization that's separate and distinct to make sure that it's focused on those products, and it has a dedicated business development group that its sole role is to go out and find innovation on the outside. And that, along with increased funding, we think will allow us to be able to innovate at a faster pace.
That's excellent. So along those lines, since we now have Allergan Aesthetics, which makes me very happy, makes all of us very happy, we also have a new president of Allergan Aesthetics, and her name, as you know, is Carrie Strom. So what is Carrie's role as you see it as the CEO and chairman of the board? Tell us a little bit about Carrie's role as the president of Allergan Aesthetics.
Well, first I'd say I'm delighted to have Carrie as part of the organization. I had the pleasure of working with Carrie for about a year. That was a little longer than I had hoped while we were waiting for the regulatory approvals through the FTC and the EU. But I had the pleasure of working with her as we were working on the integration plans, and I think she's going to be a great asset for the organization. She's bright, has tremendous leadership, knows this business extremely well, and now she has the pleasure of running a roughly $5 billion, a little less than $5 billion, fully integrated global business. So Carrie will have direct responsibility for guiding this business. She'll report directly to me. We're excited to have her as part of the leadership team, the executive leadership team at AbbVie, and she'll play a critical role. She obviously has a strong team under her that will help support her, and certainly being part of a bigger organization, the financial resources that we have to offer, I think, will be extremely helpful in driving this business. But Carrie will play a very important part in getting us to where we want this business to go.
Well, that's excellent. We've known Carrie for years, and she's been a friend of ours, and as well as a friend of the aesthetics in general and the Aesthetic Society. And we couldn't be happier with your choice. So we applaud it. We look forward to working with her. We've been working with her for years, and she's part of the family. She's been involved in the strategic planning for the Aesthetic Society, and everyone loves her, and she's very bright. And we look forward to her being at the helm of your
I'm pleased to hear
company.
that as well. Dan.
Yes, you really made an excellent choice in our opinion. So,
thank you.
Well, these days have been kind of tough. You know, we're living in the coronavirus, the COVID time, and I'm kind of curious what your thoughts are about how it's affected aesthetics in general, and what do you see in the future as it relates to the COVID?
Well, certainly this pandemic has been unprecedented, and I'd say tragic in the human toll that it's taken. I mean, unfortunately, we've recently passed the 100,000 number mark of Americans who have died from this virus, and in a relatively short period of time, 3 months, and so that's just a devastating impact. It's had a significant disruption to the economies around the world, and certainly here in the United States, and that certainly has had an impact on businesses like ours or like yours. As states went into shelter-in-place orders, we saw most of the aesthetics practices shut down, and as patients no longer were willing, and appropriately so, not to go out and get procedures done, we've seen that shut down and slow down dramatically. The good news is it looks like we're on the rebound. As states and public health authorities are allowing states to come back up and different jurisdictions to come back up and start to return to a more normalized environment, albeit with the appropriate safety mechanisms in place. We're starting to see the business recover. I would say the AbbVie business in general probably was impacted to a lesser extent than many other businesses. Certainly, if you look at the airlines or the hotel industry, they were impacted to a far greater extent than ours. So we were fortunate from that standpoint. But we are seeing the rebound now of the aesthetics business, which had a little more of an impact than other parts of our business. We're starting to see that rebound. And I'd say in states where they have opened up for a period of time, several weeks, I'd say we're seeing it return to close to normalized levels. Now, we would expect that will occur for some period of time. There may be some drop-off as you have almost a warehousing effect of patients wanting to come in and get procedures. But we think it'll recover over the course of the next quarter or two. And this is a business that's been very resilient in the past through economic crises, and we would expect it to be equally as resilient now.
Okay. Well, I want to share my experiences with you on those lines. They mirror just what you're saying. We have such pent-up demand that now I haven't heard the term warehousing, but that's it. Our warehouses are full,
Right.
and the patients are coming in. We're expanding our hours, expanding the number of days, and so forth. People can't live without their Botox and their Juvederm, and it's just unbelievable. I've never seen such demand ever. So we're enjoying this period, and it's not just non-surgicals; it's also surgery also. So I think that I agree with you that we will maintain and resume where we're going to be at where we were probably within a quarter or two, although we don't know what's going to happen with the virus, right? So
yeah, although I think we're far more prepared to deal with the virus now than we were in that first round. I mean, chances are the virus is going to be with us, and there's probably some level of risk that we'll see some uptick as we move into the fall. But I think we're in a much better position to deal with the virus now than we were then. And hopefully, through vaccine work, which we're not in the vaccine business, but a number of our peers are in the vaccine business, we'll have a vaccine, and hopefully an area we are in is antivirals. And we're working aggressively to try to bring forward some antivirals that could have a real impact on COVID-19 if we're successful. Either we or some of our peers are successful with that. If you had a good antiviral therapy for this and you had vaccines, this wouldn't be a very scary situation.
And AbbVie is doing this R&D right now on antivirals?
We are. Yeah, we have a very large antiviral group. We were the innovators in HIV with protease inhibitors, which were really the first mechanism that allowed HIV patients to live with their virus. We were the innovators in the area of HCV, where HCV is another type of virus that basically is a death sentence for those patients, but it takes many years for them to succumb to the disease. We developed a therapy that basically an all-oral therapy that patients take for a month, and it cures 95% of all patients. So that group, we have now redeployed them to work directly on COVID-19. And they're making some pretty good progress. We hope that we will be in human clinical studies on some antibody therapies that are designed to block the virus from being able to enter the cell. And we hope to be in those trials in the September-October timeframe. And we'll have to see how that therapy works. But they're very potent therapies, much more potent than anything we have on the market today.
And are those in humans that you're doing this?
Yes,
these trials?
These trials will be in humans in September and October.
And where's that happening location-wise? Is it one center, or do you have a number of centers or universities? How are you doing that?
Yeah, it'll be broadly across many different centers, and not just in the United States.
Okay.
We'll obviously recruit wherever we think the pandemic is greatest, so you can get the largest number of patients. So right now that would be South America, so there'll be a substantial number of patients that will come from South America. U.S. and Western Europe will be the primary areas.
Well, that's exciting news. You did mention Alzheimer's, and I'm very curious what you have in the way of Alzheimer's at AbbVie. What's going on?
We have a number of programs, but I'd say the main programs that we have and the programs that are furthest along are anti-tau. So tau is one of the misfolded proteins that occur. You've probably heard a lot about A-beta. And A-beta is another type of protein, misfolded protein, that occurs in Alzheimer's. We believe it primarily occurs later on in the disease, and we believe tau is an earlier indicator. And so we have an antibody that basically binds to tau and sops it up, if you can think of that, to try to reduce the levels of taus in patients that have Alzheimer's disease. So we have multiple clinical programs that are ongoing now. We should get readouts on those programs over the course of the next 2 or 3 years, and hopefully we'll see some clinical efficacy around that. That's
exciting news. I know a lot of us have been affected by Alzheimer's. That's very exciting. Let's get back to the beauty business. There are now at least 5 toxins available to Americans, or 4, and I think a 5th is on its way. What are your thoughts about Botox? What should we expect, and other toxins you might be either developing or acquiring?
I think Allergan has done an excellent job with Botox. Obviously, a lot of the market research we did before we acquired Allergan, we looked at the durability of Botox. And one of the things that's absolutely striking is the brand equity of Botox. Certainly consumers almost describe it as the procedure that they're asking for. And so I think the quality of Botox, the reputation of Allergan, has certainly served the business well. Having said that, we continue to try to innovate Botox. We have a number of different programs to continue to innovate around Botox, and then we have programs that are in place for other toxins to serve different types of roles. So it's an area that we're absolutely committed to, and Botox is a brand that I think we will continue to drive very, very hard in the marketplace.
That's great. What do you think about duration as it relates to the toxins and Botox? Are you looking at a longer or shorter term Botox in terms of duration? Or
we have both in development. We have, depending upon the indication, and obviously Botox has therapeutic indications as well as aesthetic indications, and so we're developing toxins that might be used separately, some for therapeutics, some for aesthetics.
So you want to be everything and all things aesthetics. And I think back to the original Allergan before even Brent got involved and the previous owners that you just bought Allergan from. As you know, David Pyatt was at the helm in those days. A dear friend of both of ours.
I know David, yes.
So do I. And you remember when David used to say that he would never buy anything that plugged into a wall.
I do remember.
And I can remember that for years. And then along came Brent and activists and Bill and so forth. And then they acquired Coolsculpting. And Coolsculpting now is yours, and they paid, I think, about $2.5 billion for Coolsculpting, and then developed Cool Tone, which we now have, and that obviously plugs into a wall.
Right.
So I'm kind of curious how you feel about that concept. There are a lot of lasers and light-based technologies and exciting energies, radio frequency, ultrasonic energy, and various things in the beauty business, and you want to be comprehensive. I'm curious what Rick Gonzalez's appetite is. I know Carrie's at the helm of aesthetics, but I'm kind of curious, as the chairman of the board and the CEO of AbbVie that owns Allergan Aesthetics, do you have feelings like David had, for instance, or do you have an appetite for things that plug into the wall?
I think I wouldn't tell you that I have a strong opinion one way or another that I'm opposed to anything that plugs into the wall. The way we tend to look at the business is we want to look for what are the things that consumers are going to want or need going forward. And then what is the right solution for that? That solution might be a medicine. It may be a device. It may be a combination of a device and a drug combination. Right. And certainly as we've seen medicine evolve all across the world in different therapeutic areas, we've seen the merger of those technologies coming together. So I'm not opposed to basically looking at devices. In fact, I think devices will play a very important role. So what are the things that consumers want going forward? And how can we best serve those needs? And even more importantly, how do we help you continue to grow your practice so that we can grow the market, we can bring more patients into your practice and do more things. So as an example, skin brightening is something that consumers would like. And that might mean that it's a laser, that might mean that it's some other kind of technology. Body sculpting, as an example, that you referred to, Coolsculpting as an example. We now have Cool Tone to improve muscle tone. We may have products in the area of cellulite that improve cellulite. So I think what we want to do is be on the leading edge of trying to give consumers what they really want to be able to improve in the areas that they're concerned about. Another interesting area is hair growth. And we have some programs internally that we've been working with partners on, and that's an area that we're also going to continue to focus on. And again, there you have different kinds of options. You certainly have drug-related kinds of options that you can pursue in that area, but you also have device-related options. There's data in the literature that shows that certain wavelengths of lasers can stimulate hair growth. And so I would say we will look for what is the right technology or tool to meet the need that the consumer is driving for.
In terms of needs, aesthetic needs, I'm curious, what do you see as the biggest unmet need in aesthetics?
I think it varies to some extent. Certainly hair growth, I think, will be a big opportunity if you can come up with the right kind of technology for that. I think certainly stimulating elastin and collagen to create more of a brightness and an elasticity to skin, in addition to just physical filling, will be an area that will be of interest, and an area that we're obviously working on right now. And so I think those are some of the areas of interest longer term.
Great. I would agree with you.
Good.
And perhaps also cellulite, stretch marks.
Yes.
The holy grail, right? Any thoughts about breast implants? I know you're new to the aesthetics business. I don't want to put you on the spot, but you also acquired, obviously, a great breast implant business when you acquired Allergan. Any thoughts about
we think breast implants are an important part of the business. They're obviously an important part of our customers' practice, the plastic surgeon's practice. They're obviously a significant part of that business. And there, too, we think there's an opportunity to probably bring more innovation to the market over time. It's an area that we're looking at on the outside to see whether or not there are some technologies there, and also have some internal efforts. So I'd say we're absolutely committed to the implant market, and we plan on trying to innovate in that area as quickly as we can.
That's terrific. Yes, it is an important part of a board-certified plastic surgeon's practice, and your implants that you acquired are excellent, and we have been using them for years, and we would certainly welcome more new innovation and expanding that market, and certainly want to keep you in that market. I'm happy to hear that you want to stay a part of that.
Yes,
there were rumors around that you might divest yourself of breast implants.
No.
No plans of that?
No, those rumors are not true.
Okay, good. I'm trying to think of any other questions to ask you that I prepared for. Are there any things that you would like to tell our audience that we haven't covered, the aesthetic and plastic surgeons and the listening to you? Anything about AbbVie or Allergan Aesthetics or yourself?
No, I mean, we're very excited to be part of this business, and as I said, we're committed to do two things, essentially: to grow the market as much as we can, and to work with our customers, you, to help you expand your practices as much as you can, and to be a good partner in doing that. And then the second thing is bringing true innovation to this marketplace. One of the nice things about being a company of our size is we have the financial wherewithal to do pretty much anything we'd like in this business. So our goal is to increase the level of R&D as rapidly as we can in this business. Obviously, we have to have the right programs to be able to support that. And but as we get programs that we're interested in and we think can really advance the level of innovation out there, we're certainly in a position where we can fund those. And the same thing on the business development side. We're obviously in a position that we can acquire significant amounts of assets that we could add to this business, and we're committed to do that. Our business generates about $19 billion a year in free cash flow, so we can obviously support a significant level of acquisitions. I'd say the other thing that I have heard that's probably worth addressing is I've heard a concern that, okay, now Allergan's going to be part of this behemoth called AbbVie. And that's going to slow them down, and they're going to become bureaucratic, and they're not going to be what we saw before. I'd say the first thing is we didn't spend $63 billion to mess up the Allergan business.
Right.
So it's a pretty important baby for me and for us. But I'd also say, if you look at AbbVie, we're obviously a big company, right? We have a market cap of $165 billion, I think, today. And we have 47,000 employees around the world, and we operate in virtually every country around the world. So we're a significant size company. But we operate more like a smaller biotech, because the way we operate internally is we take each of our franchises and then we have them run as independent units within the company, so that all they do is focus on those particular markets that they operate in. So it allows those units to be very agile and react very quickly in the marketplace, much like a biotech can operate. And so I think we've been able to refine our culture in a way that we have the best of both worlds. We have the ability and the agility of a biotech, but combined with the financial wherewithal of a very large pharmaceutical company. And that's rare in our industry. And I'd say in particular, if you look at the model that we have set up for the aesthetics business, it is set up really to allow that to occur very rapidly and very effectively. We used this same model when we first got into oncology. AbbVie wasn't in oncology when we first spun out, and we acquired a company called Pharmacyclics. And that was our first large oncology drug that we acquired. We set it up as a fully independent unit or business within AbbVie, ran it just like we're talking about running the aesthetics business. And when we acquired that product, it had about $500 million of sales. This last quarter, it had an annualized rate of just under $5 billion. So obviously the model works.
Right.
And so I think we'll look back on this acquisition, and I think we'll be extremely pleased, and I hope you, as a customer of ours, will be even more pleased with what we've been able to do going forward.
Well, I couldn't be happier, and what a luxury position you're in, and what a unique environment to have that kind of cash and also that innovation and run it like a small biotech. I am personally very excited to be working with you as your as a sponsor, as a partner, as a physician that purchases products from you. I'm really excited. I'm excited for the Aesthetic Society with your commitment to R&D in this space, in the aesthetic space. As I mentioned, we're over the moon excited about Carrie Strom being your president of Allergan Aesthetics. And it's been a pleasure getting to know you better, Rick. Look forward to seeing you again soon, seeing you at the Aesthetic Society meetings, and introducing you to all my colleagues. So I want to thank you very much for taking time out of your busy schedule to come here to the studio and be my guest here at my first show, The Technology of Beauty.
Well, I appreciate it very much, and I can tell you I am equally as excited about all of those aspects. I'm excited about Carrie, and I'm certainly excited about being in this business, and I look forward to all of us being very successful going forward.
That's terrific. Well, I'd stand up and shake your hand, but I can't.
We can't.
So thank you very much. See ya.
Thank you,
everyone.
Take care.